So now we're going to move into women's health and disability. I'm really excited for this panel. I think we have a lot of great panelists, and it's going to be a really good discussion. So we have Brooklyn Marx joining us again. So for those of you who weren't in our morning session, Brooklyn was diagnosed with SMA, and she works with individuals and families as they transition to parenthood, manage their mental health, and explore child behavior. We also have Shailynn Taylor. Shailynn was also diagnosed with SMA. She studies the criminal justice program and hopes to enter the field of law or probation once she has completed her degree. She is also an advocate and does a lot of work with the Love for Lewiston Foundation. We also have Megan, who is also diagnosed with spinal muscular atrophy. She is the founder of No Such Thing as Normal, a company with a mission to help others redefine purpose by removing defining labels. She is an author who is currently producing a series of children's books. She is also a wife and a proud mother of 2 boys. Next, we have Dayle, who was diagnosed with a neuromuscular disorder. Dayle is the lead designer at Dayle website design and social media consulting, as well as an interior design company. And finally, last but not least, we have Dr. Hilary Brown. Dr. Hilary Brown has their PhD as an assistant professor at the University of Toronto in the Department of Health and Society. Dr. Brown holds a Tier 2 Canada Research Chair in Disability and Reproductive Health. Her research program uses epidemiologic methods to examine maternal and child health across the life course, with a particular focus on populations with disabilities and chronic disease. So an amazing panel. Thank you everyone for joining us. So I'm really excited for this panel because I feel like as a woman with a disability who's fairly new into adulthood, I feel like there's a lot of emphasis on just the neuromuscular disease when it comes to, navigating my health team. And there hasn't really been a lot of emphasis on just the fact that I am a woman. So I wanted to know what your experiences were. Do you feel that you have adequate information from your doctors in terms of women's health, or do they kind of just focus on the neuromuscular disease? Does anyone, Brooklyn, do you want to jump in with that?
Yeah, I would say I have a pretty good, one of my doctors is, my GP is really, really good at making sure that she's still addressing my standard health, including being a woman. But I only switched to her a couple years ago. And before that, it was very focused on SMA and other aspects of health. It wasn't really brought up about any other women's health concerns around pap smears, and any kind of reproductive health wasn't really addressed in the same way that my peers the same age were. And I've heard that as a pretty common experience among other people, other women that I know with neuromuscular disabilities. Is pretty common that doesn't really get addressed, whether that's because they don't really know how to approach it, whether that is because they have this belief that we're not sexually active or whatever that might be. And so it's been nice to get more of that with my current doctor, but I know that's still a really big common issue across the board.
Shailynn, do you have anything to add to that?
Yeah, I'm very similar to Brooklyn. The only difference for me was that when I was 12, they decided to put me on birth control so that I wouldn't get a period. And so since I was 12, I've been on some type of birth control. So it's been 13 years now of always being on some type of birth control. And I don't think that it was ever really explained to me the impact of that, or really even why I had to take it. It was just it's easier to care for me if I took birth control. growing up.
Megan, do you have similar experiences to that?
My experience is more, I had to approach the doctors myself. It never was presented to me as here's kind of the next steps, as you're going into, teenager years and adulthood and stuff. I had to go to them and say, hey, I would like to be put on birth control when I got married, and then approaching, parenthood and stuff like that. I feel like, I do feel like my needs with neuromuscular was always the top priority. When I sat back and thought about it as we were, talking about what was coming with these questions, I thought, most of my issues probably were more related to the fact that I'm a woman and, handling whatever, whether it's emotional or, hormonal or whatever. And so I felt like, well, yeah, my doctor didn't really approach my needs in that aspect right away until I came to them. And then the need was addressed. So I don't think it was, I don't want to say it wasn't priority. I just think, like she was saying, I don't think they didn't think I was sexually active, or just didn't have a need for those things to be addressed until I brought it to the table.
Yeah, definitely. So I guess what would be your advice for, a woman who's transitioning to adulthood, if their family doctor hasn't, brought up getting pap smears and all the regular women's health stuff? Do you have any advice for advocating or bringing that up to your health team?
I feel like I kind of went traditional way, and I asked my friends, what doctors do you use that you like? Because at that time we weren't addressing anything neuromuscular necessarily, because I wasn't looking into getting pregnant or anything at that moment. It was more getting my periods under control, things like that. And so I have had both experiences where I've met a doctor and they have zero idea of how to handle anything related to do with neuromuscular. And then I've had others who, the doctor, which we can go into later, but the doctor that I ended up using as my Ob Gyn for when I got pregnant, she hadn't had a patient, but she went and did her research. And that's what I appreciated the most, because I'm not coming to you asking you to have all the answers right away, but I want to know that this is a team and we're going to figure this out the best of our ability. And so I ended up finding a great OB that addressed my needs, both understanding that I had a neuromuscular, but that I'm a woman, and these are just some of my needs that I have. So
Yeah, for sure. Shailynn, can I jump back over to what you said for a moment about the birth control? I know a lot of women with SMA are put on birth control. Do you want to talk about your experiences with that, and maybe if you would recommend it or wouldn't recommend it?
For sure. Sorry, my service dog is very aggressively drinking water in the background right now. So excuse him, but I have been on multiple kinds of birth control, and it definitely is helpful with regulating periods, knowing when you're going to get it. If it works like that. When I was 18, I switched from pills to IUD, and my first one was good for 5 years. And then when I switched to a new one a couple years ago, I've had nothing but problems since. So I think that it's very person by person as to what works best for them. I've also found that I'm currently taking risdiplam, and I've found that it really impacts how effective my birth control is, how well it does at regulating my period. And I've had lots of issues. I'm on my 3rd year in risdiplam, and I'm now having some other women issues that they're not sure if it's from the drug or anything like that. And so right now I'm really going through exploring with my doctor, who's never worked with anyone with my disease or been on this drug, to kind of see whether this is just me or part of the drugs, or what exactly will work best for my body at this time. And so I would also say it's very trial and error, and not to get discouraged if the first type that you try isn't working for you.
Yeah, that's really good advice. I think it's not only with women's health, but like a lot of other issues. It's kind of that, is it related to my SMA or is it like a completely separate issue? And I find sometimes we don't have the doctors and we don't have the support to be able to figure out that issue. Do you mostly use like your family doctors, or do you find that you have specialists? Like, how do you navigate these women's health issues?
So I'm kind of like Megan. I asked my friends around here who they used as an OBGYN, and I ended up using the same lady that delivered Lewiston. So she'd heard of SMA because Lewiston had SMA, but she'd never worked with a woman who had SMA. And so she was very willing to learn and figure that kind of thing out. And I was the one who had to request from my GP for a referral to an OBGYN. And I had already brought the name of the person I was hoping to get referred to with me, just by word of mouth and knowing that their clinic was fully accessible. And yeah, some of the little background things you want to check before you go seeing your doctor, especially something like this, where you often have to get out of your wheelchair and have the space to be transferred and the means to transfer.
Yeah, Dr. Brown, I'm not sure if you have anything to add to that in terms of like actually finding a doctor that works best for you. We have some questions in the chat just about how do you find the right doctor that's able to accommodate your disability?
Yeah, it's a great question, and all of the comments that have been made so far really resonate with what we hear from the people that we interview in our research. And I think, it sort of really depends on where you live, but often there can be organizations that can be really helpful in terms of narrowing down, a list of doctors that might be helpful. So for example, in Toronto, the Center for Independent Living is often a really helpful resource. They have a parenting program for people with physical disabilities that a lot of the women that we work with have gone there to ask questions, connect with other parents, hear what OBs those parents used. And unfortunately, it often is kind of a word of mouth sort of scenario. But I think, do try to look around and find a physician that you're comfortable having those conversations with, because often it will be you to be the one to bring up questions about reproductive health and contraception and thinking about whether or not you want to have a baby. So, try to make sure that you have a doctor that's responsive and, that you feel comfortable having those conversations with. And certainly, again, there are resources out there. It's just a matter of finding them. And I'll try and put some in the chat as we're speaking as well.
Yeah, that would be perfect. Thank you. And Megan, I just wanted to jump over to you for a minute. I know that you mentioned that you're a parent. Is that something that you had to like plan well in advance? Like, did you talk to your health team beforehand, or can you talk to us a little bit about that process?
Yeah, so our process was that when we got married and we knew we wanted to build a family, we weren't sure what that was going to look like, if that was going to be my body or adoption or what. I first wanted to know what my options were and what doctors thought was going to be the safest route and just all that. But I had a pretty good idea that they were not going to have experience with someone with SMA being pregnant. So I found a specialist that was a high risk OBGYN. So she handles multiples, people with other sicknesses or diseases that are pregnant. And so I came to her and I said, explain my situation, that this is what I have. She had not had a patient with SMA. But again, like I said, she said, well, let me do some research. Let me talk to other colleagues and get back to you. I'd say maybe 3 weeks later, we had another appointment and she said, from her findings, the only thing that she ever saw was a concern was obviously monitoring my lung function and oxygen and preterm labor. And so she monitored my cervix like crazy. And so really it was what I loved about this doctor was that she was willing to lay out options for me. And I've had experience with doctors that they look at my situation and it just freaks them out. And they're like, no, this isn't a good idea. Don't do that. And not that I'm not open to, obviously they're professional and I want to know their opinion, but I didn't like not feeling like it was a backed decision for some of those. And so with her, she was amazing. And she just, she took extra precautions. I went in and we did ultrasounds every week in my last trimester. But I think the encouragement for others is that you have options to see other doctors. So if you see one and you're not comfortable with what they're telling you, is there, you can see other doctors. That's your choice. And I think reaching out to other people who have experience with it, something like this, or even just through social, is very helpful. Now, I know everyone's body, is different. But I found that to be a great resource for me, was other women that had a similar frame as me. What was this like? What, were you comfortable? What are your tips and tricks? Other moms were doing that. They just didn't live with SMA. So, yeah.
And I don't know. Yeah, for sure.
Sorry, just thinking of what Megan said, I'd encourage people too to think outside the healthcare bubble as well. Occupational therapists often have great ideas related to making things more comfortable if you're pregnant or caring for a newborn, making things more accessible. And I think, often we think about occupational therapy outside of the parenting and pregnancy sphere, but they can be really helpful in that sense as well. So think outside the kind of, traditional medical care bubble when you're thinking about the types of resources that might be useful.
Can I touch on one other thing too? When we were talking about contraception, one thing that I really enjoyed about a different doctor I had is that I went in with my idea, I want this kind of birth control, this is what I want, here's why I thought. And he kind of laid it out to say, hey, with your body physique, this is my suggestion, maybe not doing this kind or this kind. And it kind of opened my eyes to other options too. So sometimes I think we're our best advocates. Yes, we are. But I think also being willing to hear what, because there was options I didn't even know existed. And I've been on a birth control now for 6 years that I've really enjoyed. So just kind of keeping that open as well.
Yeah, I think that's a really good point. I think especially as it relates to women's health, like I said, like a lot of our family doctors or OBGYNs, like they don't know what SMA is, they don't know what neuromuscular disorders are. So sometimes it is about us like advocating for ourselves and bringing those resources to them. I guess my question for you, Megan, is when you were considering becoming pregnant, like where did you go to kind of I guess find resources or like lived experiences of other moms with SMA? I don't know. I'm just curious. Like there's obviously social media, but I feel like a lot of our doctors like have no idea what to expect. So how did you kind of come prepared to your doctors with this information?
Sure. I think for me, the biggest, I guess maybe someone gave me this advice, I'm not sure, but I wanted to find a high risk doctor because I feel like obviously my situation was different. How I was going to be delivering was going to be different. And so that was the first thing I did. I looked in my region, my area, was there a high risk OBGYN that was accessible to me? And then when I approached her, I scheduled the appointment, I came with as much information that I believed was going to be helpful. And then obviously connected her with my primary and my pulmonologist. And we tried to just keep everyone on the same page. And then going into, I had the baby by cesarean. And so that was the whole surgery. So we were very much on the, a lot of communication for the pulmonologist and the anesthesiologist, and then my OB, obviously, because I did go under general anesthesia for that. But yeah, I think that my biggest, the internet's a great tool. So just searching around, calling around, But I actually do think that the numbers are increasing of women that are having children with neuromuscular diseases. So don't feel like you are the only person. Ask the doctor, have you ever had a patient with this? What was your experience? And it might not be the exact type of neuromuscular disease that you have, but it could be a different type and it could have some similarities. And then I use social media as my connection to a ton of other women, and asking questions. And there's Facebook groups that are moms with muscular dystrophy. There's Facebook groups specifically for SMA. There's a lot of people willing to share their information.
I'm just going to jump over to Hamira. Hamira, I saw in the chat that you mentioned there was a few questions. Yeah, are you able to read out those questions? I'm not sure if I see them in the chat.
Yeah, there was just a question here about, it's for Dr. Brown. It's really hard to find the right person. And through your research, can you speak about people's experiences in finding the right healthcare team?
A really good question. And it's challenging, I think. It's exactly what we hear from a lot of people, that you might try on a few doctors for size, like some of the other panelists have mentioned, and maybe some won't be a great fit and you'll have to search around. And I know that's not ideal, because, you shouldn't have to be the one always doing the research and the legwork to try to find a really good healthcare team. But I think that is sort of the reality. And like others have said, ask questions, make sure that you're comfortable with the relationship, make sure that it's a doctor who's also willing to work with your other providers. So you may have, your family physician and your specialist, and then OB or gynecologist, depending on sort of the area of women's health that we're talking about. In an ideal world, you want all of those people to be talking to each other. You don't want to have to be the person sort of being the messenger between them. And certain, healthcare teams are more willing or able to do that. So, one piece of advice that we hear a lot from the women that we interview is look for healthcare teams that are communicative and that have resources available to act as the navigator among those healthcare teams. Again, not always possible. Sometimes you will have to be the navigator yourself. But in an ideal situation, it's really helpful to have physicians who are willing to work together as a team.
And Shailynn, we do have a question in the chat about the Metrophenol surgery. And I know you've had that. Can you talk a little bit about that and like what that has meant for your independence?
Yeah, definitely. When I was in grade 12, I didn't have an EA, but I couldn't go to the bathroom at school. And it had just become such a big thing of controlling what I drank to be able to schedule bathroom visits. And I talked to a friend from the US who had SMA, and she told me about this surgery that she had called the Metrophenol Procedure. And I got it done and can say it's like the best decision I ever made. They use your appendix or a piece of your bowel to create a channel from your belly button into your bladder. And then you intermittent catheterize through that channel. And so my belly button looks like it did basically before surgery. There's a tiny channel on the inside of it. And I'm able to drain my bladder into the toilet without leaving my chair or without relying on someone else to get me on and off the toilet. And so that's been a game changer for my independence, for being able to go away to university, all those kinds of things. It just made one less thing I had to worry about when scheduling care and just managing day-to-day life. It was a very easy surgery for me to recover from. And I guess one of the things to be careful with when you get it is that it does increase your risk for bladder infections. And so that is something that I've had to figure out a balance for, and what works on the prevention side, but also what works when I need to treat them. But other than that, I have nothing but good things to say about it. And I'm happy to answer any like more specific questions afterwards as well. Yeah, if anyone is really interested and has more questions.
Yeah, and I just wanted to say that I've had the Metrophenol procedure as well, and it was honestly the best thing that I could have done for my independence. And it wasn't something that a doctor brought up to me. It was something that I learned from others in the SMA community. So yeah, if anyone has any questions that they want to put in the chat about that, I'm sure Shailynn and I can talk more about that if anyone's interested. Brooklyn, I just want to go over to you for a minute. I know you have a lot of experience with women's health, like in your professional career. Can you talk to us a little bit about that and maybe any advice that you have for everyone here?
Yeah, I've been working a lot more with parents who have disabilities. So a lot of my early practicum experience was focused. It was focused around families and parenting and navigating that transition. And a lot of the families that I was practicuming in focused on had kids with disabilities. And so I had a lot of experience working with them. And obviously that was helpful from having previous experience as a person just in the SMA community and in the disability community, already like navigating, helping families through new diagnosis and stuff like that. But a big thing that was really important to me was to focus more on actual parents who have disabilities, because I feel like a lot of the times when we talk about supporting parents in the realm of disability, it's always focused on parents who have kids with disabilities. And that's of course very important, but I think it's also really important to touch on the parents that have disabilities or chronic illness themselves, to really make sure that they're getting fully supported and that they have the resources, the support, the tools that they need to actually parent in a way that feels good and that's safe for them and their kids. And so I've been doing increased work. My supervisor's been really great at letting me expand into that area and really focusing on how we can help parents where they're at with their disability, making sure that they know what their rights are, making sure that they know what services and support is available to them, so that it can make that transition a little easier. Because even what Megan had said was about like not really knowing who to talk to, or having to have that community where you can actually get people who have been through it before and have experience, is something that's really valuable. And so I really, that's something that is really important to me, focusing on how to help parents navigate that, because parenthood in general is always such a big transition for every single person. And then if you add disability into the mix, it's just even more complicated.
Yeah, definitely. I think actually that was something that I never even considered. Like obviously there's a bunch of considerations that go into giving birth or getting pregnant with a disability, but then like being a parent in itself, like there's a lot of support that needs to go on around that. I don't know if Brooklyn or Dr. Brown, if you want to talk about, I don't know if it'd be Ontario specific, but like maybe some of the supports that are available to mothers or parents with disabilities.
Yeah, I mean, I can give a couple of examples and then I'll pass it back over to you, Brooklyn. There's an organization, it is based in Toronto, but they have web-based resources and abilities for parents to connect virtually. It's the Parenting with a Disability Network through the Center for Independent Living. And I'll put the link in the chat as well. They're fantastic. And again, it's just a great place for parents to meet each other, share stories and that sort of thing. There's also an international program out of the States, the Center for Parenting and Disability, that has a ton of amazing resources. It is American, but a lot of them I think are helpful, worldwide. It's similar sorts of systems that people have to navigate here. So even if you live outside of a major center, especially in the age of COVID, right, there's more and more ways to connect virtually. So definitely some neat resources there. So again, I'll drop some more links into the chat related to that.
Yeah, and one that I do know that I've found has been really common in the disabled community is it's called the Disabled Parenting Project, and it's an online community that offers a lot of resources. It's not necessarily local, but there might be supports that are offered or links that to local areas. I'm pretty sure it's American and also Canadian, but I could be wrong about that. But I do know it's an online and it has tons of resources that are beneficial for parents no matter where they live. And it really does focus on like networking parents and getting everyone together to actually talk about their experiences, share their resources, and share their journey through it. And so that URL is just disabledparenting.com. But I can put that in the chat as well. So that's not necessarily local, but it's definitely has a lot of good resources.
Yeah, that would be perfect if you could put that in the chat. And Stephanie also just said that in Ontario, through the direct funding program, you can access nurturing support for funding for mothers to care for their children. So that's also really amazing. I'm not sure if that's available in other provinces, but definitely something to look into. So we have 10 minutes left. Amira, you said there's no remaining questions. Is that correct in the chat?
Yep, we've got to the questions in the chat. That's great.
Okay, perfect. So I guess, I mean, we've kind of gone through all the questions in terms of that I had, but is there anything that anyone else wants to add in terms of, you know, anything regarding women's health and disability or parenting? Anything that anyone wants to add?
I had a question that maybe the other panelists could touch on. When it comes to menstrual cycles, what do you guys have any tips or advice on care for that? Is that your, just tips and advice for that for others? Because I know that can be a daunting thing for young women or young girls that will be entering into that stage of life, and how do they handle it? And for the parents especially, how do they handle it? And for the caregivers, what is their best advice for handling?
Yeah, I'll go first. Go ahead, Brooklyn.
So I'm similar to Shay. I've been on birth control since I was 14. So it's 13 years now as well. And so that I have it on a cycle I do 5 packs of 21 days and then 1 week off. So I only get my period every 15 weeks, essentially. That's something that's always worked for me. I haven't really had to switch kinds or anything. It's just been really good. It is something I'm going to talk to once I get a referral for my OB. I'm going to be talking to them about that to kind of dive more in, because I just had the general info. Kind of like Shay, I didn't really get any, there wasn't much of a discussion about it. It was very much just to make it easier for care, we're just going to limit it. And at 14, I was like, great, this is a pain in the butt. So yes, I will happily take this pill if it will go away for longer periods of time. And then as an adult, I see that there might be some other things that I actually want to discuss and want to explore. So I do get it every 15 weeks. For me personally, it's been quite a challenge to find out what is easiest. I've kind of tried all of the things, whether that's pads, tampons, Diva cups, pretty much all of it I've tried. I found what's best for me in the last few years has just been the period underwear that's through Thinx. I think there's someone in one of the online communities that used it and had really good experience. And I found that was most comfortable for not only me, but also for my workers. They found it was the easiest to kind of navigate with me, and knowing that they're comfortable and I'm comfortable is the highest priority. So that's what's worked for me. But I do know there are so many different options, and you just kind of have to try until you find what one. Like, it's been a long time coming to find what works, but I've found it now. But it takes time. So
yeah, I'm the same as Brooklyn. That's been my game changer also. I use Nix, which is another same kind of deal company, but they have a Nix teen line. And so they make underwear small enough for like 12, 13-year-olds in cool patterns. And so a lot of families that I've worked with as their daughters with SMA have gotten to that age. I've really recommended that as the easiest way to do it. And yeah, I find it's way less traumatic for everyone involved. And it's clean, like you feel cleaner. It just, yeah, it's been a game changer for me. So yeah, if you haven't tried like Thinks or Nix, I highly, highly recommend. And they have different ones for any time through your cycle. So there's ones that can hold the equivalent of like 2 to 3 tampons of blood. So I've never found that I leak through them wearing them all day without getting out of my chair to go to the bathroom, which was an issue I had with lots of other forms of dealing with it.
That's awesome. Yeah, I think for me, it progressed and changed as I got older. Like when I was really young, you know, we were trying to figure out pads and all that because I wasn't comfortable with trying tampons yet. But with my physique, it was, I have really crooked hips. And so it was just a hot mess all the time. And so that was discouraging. And then I think once I was comfortable with tampons and things like that, that was a lifesaver because it was just clean and simple, but not everyone's comfortable using those or inserting those if you can't do them yourself. And then because I was not on birth control until I realized how easily I was getting pregnant. So my kids are 20 months apart. So then after my second, I was like, okay, I have to get on birth control for our sanity. And then actually from my experience, when I started birth control, I did not get periods at all, which was an interesting thing for my body. But before that, and this might be really common too for other families, is when I was younger, I did not have regular periods at all. They were very sporadic. They were and one doctor told me, oh, that's just because you're not physically like active. And I don't know how much of that is true. Dr. Brown, you could, yeah. My mom was like, I don't know about that. And so but the hard thing about that was that we never knew when my period was coming. And so it was very irregular. Some days or sometimes it lasted multiple weeks. So getting that under control was one thing. But yeah.
Perfect. So we have 3 minutes left. We do have a couple questions in the chat. For Shailynn, what's your metrophenol? Obviously, UTIs are like very common. Do you have any suggestions for how you navigate that?
Yeah, so I've had mine for 7 years now. So I've come up with like a few tricks. Taking daily cranberry supplements is a very good preventative measure. When I do have infections, drinking a lot of cranberry juice really helps ease the symptoms of it. I've found that if within 3 days I don't respond to an antibiotic, I know that I need to go into Emerge and do 1 dose of IV antibiotics just to kind of kick it and get the antibiotics able to work. And I also have started flushing my bladder out. And so I will put a syringe onto the end of the catheter that like pee would normally come out of. And then I use the syringe to put saline in, like I fill the syringe with saline by pulling it through the catheter. And then I put the catheter in my belly button and flush the syringe of saline into my bladder. And then I try to sit with it there for like 10 minutes and then pee it out normally. And that's a really good way for me to like break up it. You can get some like sediment that builds up just from repeatedly putting a foreign object in and out of your body. And that's a really good way to kind of break that up, and also a good prevention technique as well.
Yeah, and I second the cranberry pills as well. I also take those every single day. And I don't know if you've experienced this, Shailynn, but I was also getting more UTIs once I started Ristiflam as well. So yeah, I've started making that a daily routine, and it's definitely helped a lot.
Yeah, Yeah, I have found that risdiplam, I find a lot of my infections come from like getting dehydrated because there's always a bit of like foreign material left in your bladder that could cause infection. And as long as it's being rinsed frequently enough, it's not causing symptoms. But I find that if I become dehydrated, those symptoms get quite bad. And I found that risdiplam really does require me to drink a lot more water than I did before. And so, yeah, mixing the cranberry with like quite a bit more fluids with risdiplam has worked for me. I've only had like 2 since I realized that the dehydration was a part of it. And so, yeah, I think it's just forcing yourself to drink lots of water, which is so strange after years of like controlling your water and making sure you weren't going to have to pee somewhere where you couldn't. Now you're trying to remind yourself to constantly drink water. And yeah, it's just a change. And there, you can't feel bad if you end up with an infection because they're inevitable. Even if you do everything right, it's still a chance. And so, yeah, just really doing the prevention when you remember to. And if not, just making sure it's fully treated before you're off antibiotics.
Awesome. Well, thank you so much, everyone. That was an amazing session.